You're standing in your doctor's office. The lab results are in your hand. Everything looks normal. Your testosterone? 600 ning-DL. That's textbook normal. Your doctor literally says, your levels are fine. I don't know what the problem is. But here's what's happening. You feel like complete garbage. Your libido is gone, not declining. Gone. Your energy? You're pushing through the day on fumes and coffee. Your body composition is shifting. Fat is collecting where it shouldn't be. And no matter how hard you work in the gym, you can't seem to build muscle anymore. You feel soft, bloated sometimes. Your mood is lower than it's been in years. So you're standing there, looking at this lab result that says everything is fine, and you're thinking, if testosterone is normal, why do I feel like I'm dying? Here's the thing nobody tells you. Your testosterone level isn't the problem. It's what your body is doing to your testosterone that matters. And by the time you understand this, the damage is already spreading through your whole system. Today, we're going to show you exactly why your hormones have turned against you, and more importantly, how to flip the switch back. Let me introduce you to James. He's 38. Successful guy, owns a business, married with 2 kids, goes to the gym 4 times a week. On paper, his life looks good. But here's his reality. He used to be the guy who wanted sex multiple times a week. Now, he's actively avoiding it. His wife noticed. She's concerned. He's embarrassed. He doesn't want to talk about it because in his mind, admitting this means admitting he's broken somehow. He goes to the gym and sees guys who are half his age pulling way more strength than him. He used to deadlift 405 for reps. Now, he's struggling with 365, and his recovery is shot. He's sore for days. His energy crashes around 3 p.m. every single day. He used to drink coffee as a bonus. Now, he needs it to function. Without it, he's foggy, irritable, and unmotivated. And here's the part that drives him crazy. When he looks in the mirror, his chest looks softer. He's not overweight. His body fat is maybe 18%, but his upper chest and chin area has this puffy, undefined look. He catches himself from certain angles and barely recognizes himself. So James does what most men do. He goes to his doctor. His doctor runs a testosterone test, 600 ning-DL. Normal range is 300-1000. So technically, James is fine. His doctor says, your testosterone is in range, keep living your life. James leaves feeling 2 things: relief that there's nothing seriously wrong, and complete frustration that he still feels terrible and nobody can explain why. He goes home. He tries to feel better. He doesn't. 3 months later, James's situation hasn't improved. So he goes down the rabbit hole. Reddit, YouTube, fitness forums, and somewhere in the comments section, someone mentions the word aromatase. That's when everything changes. Here's what James discovers, and what most doctors won't explain to you. Your testosterone level doesn't exist in isolation. What matters is the ratio between testosterone and estrogen. You have an enzyme in your body called aromatase. Its job is to convert testosterone into estrogen. In young men, this is a balanced process. Aromatase works in healthy amounts, and you maintain a good hormonal equilibrium, but something happens after 35. Your aromatase activity goes up significantly. The primary location where aromatase is active, your fat tissue. More specifically, visceral fat, the fat around your organs, and also subcutaneous fat under your skin. Here's the vicious cycle. As you age, your metabolic rate naturally decreases. You're slightly less active than you were at 25. Your insulin sensitivity starts to drift. You hold onto body fat a little easier. That body fat contains aromatase. More fat equals more aromatase. More aromatase equals more testosterone being converted to estrogen. More estrogen equals your body starts to hold on to more fat, especially around the chest, abdomen, and face. This is the trap. This is how you end up with normal testosterone but elevated estrogen. And here's what elevated estrogen does to you. Your libido crashes because estrogen increases prolactin, which directly suppresses sexual drive. Higher estrogen also reduces the sensitivity of androgen receptors. Basically, your cells can't hear the testosterone signal as effectively. So even though testosterone is present, your body isn't responding to it. Your muscle-building potential tanks because estrogen preferentially signals your body to store fat rather than build muscle. When you're in the gym, the anabolic signal is muted. Your mood drops because elevated estrogen can disrupt dopamine and serotonin signaling, leading to brain fog, lower motivation, and sometimes even depression. You feel softer, puffier, and less defined because estrogen drives water and fat retention, especially in the chest and face. You get tired because of the metabolic dysregulation and because excess estrogen can interfere with thyroid function. But here's the thing. Your testosterone test comes back normal because estrogen doesn't show up in a standard testosterone panel. Your doctor looks at your testosterone number. It's 600. He says, "You're fine." And he's technically right. Your testosterone level is fine, but he's also completely missing the diagnosis. You're not dealing with low testosterone. You're dealing with hormonal imbalance. This is the critical distinction that separates men who fix their problems from men who stay confused. Now let's zoom out and look at the bigger picture of why this is happening to you specifically. You're 35 or older. You've probably been working, probably stressed, probably not sleeping as well as you did at 25. You might be drinking more, training harder, or both. Your diet probably isn't as clean as it was in your 20s. All of these factors, stress, poor sleep, excess alcohol, a calorie surplus over many years, they increase your body fat, especially visceral fat. And visceral fat is basically an aromatase factory. So you end up with this perfect storm. Your testosterone production might be slightly declining naturally. It drops about 1% per year after 30, but that's not even the main problem. The main problem is that whatever testosterone you are producing is being converted into estrogen at a higher rate than it should be. The result? You feel horrible. Your doctor can't figure out why, and you're stuck. But there's something else happening too. Let's talk about phytoestrogens. Phytoestrogens are plant-derived compounds that act like estrogen in your body. They're in soy, flax seeds, certain plastics, BPA, pesticides on non-organic produce, and dairy from grain-fed cows. Are you eating soy protein? Drinking from plastic bottles? Eating conventional vegetables? Consuming conventional dairy? Then you're getting a constant low-level exposure to compounds that mimic estrogen in your body. Combined with your elevated aromatase activity, this is like adding fuel to a fire that's already burning. You're not just dealing with your body's own testosterone to estrogen conversion. You're also absorbing estrogen-mimicking compounds from your environment. This is why the problem often sneaks up on men. It's not one thing. It's the accumulation of age-related decline in testosterone production, minor, increased aromatase activity, major, body fat accumulation, major, environmental xenoestrogens, moderate, poor sleep, high stress, suboptimal diet, moderate. Each one alone might be manageable. Combined, they create a hormonal crisis that most doctors completely miss because they're only looking at one number, testosterone. So James is reading about aromatase. He finds out that his doctor never measured his estrogen level. He asks himself, could this be my problem? He goes back to his doctor and asks to get his estrogen tested. Specifically, he wants estradiol, the primary form of estrogen in men. His doctor's response? That's not necessary. Your testosterone is normal. But James pushes. He gets the test done at a private lab. Results: his estradiol is 52 pg/ml. The normal range for adult men is 10 to 40 pg/ml. He's elevated, significantly. And suddenly everything makes sense. His testosterone isn't the problem. His testosterone is fine, but his ratio of testosterone to estrogen is completely off. His body is swimming in relative estrogen dominance. Now, James understands why he feels the way he does. And more importantly, he understands that this is fixable. But here's where most men make a mistake. They think the solution is to take an estrogen-blocking drug or an aromatase inhibitor. They think they need pharmaceutical intervention. Some men do eventually go that route. But before jumping to that, there are 3 powerful, natural protocols that can shift your hormonal balance dramatically. And James is about to discover them. The first step is simple. You need to reduce your body fat. Remember, aromatase lives in your fat tissue. Less fat equals less aromatase. Less aromatase equals less testosterone being converted to estrogen. This isn't about getting shredded. This is about getting lean enough that your hormonal conversion rate normalizes. For most men, this means getting to 12–15% body fat. If you're currently at 18–22%, that's a meaningful change, but it's absolutely achievable. But, and this is important, you can't just do a standard calorie deficit. Why? Because a standard deficit often involves too much cardio, not enough protein, and not enough strength training. This leads to muscle loss, which makes your hormonal problem worse, not better. Here's what works. A moderate calorie deficit, around 300–500 calories below maintenance. This is aggressive enough to lose fat, but not so aggressive that your hormones crash. Prioritize protein. Aim for 1 gram per pound of body weight. Protein is anti-inflammatory, it preserves muscle during a deficit, and it increases satiety so you're not constantly hungry. Strength training. 3 to 4 times per week, focusing on compound movements. When you build muscle, you increase insulin sensitivity, which helps regulate your hormonal profile. Muscle is also metabolically active, which helps with the overall fat loss. Walking. Underrated, but true. 30 minutes of low-intensity walking daily doesn't stress your system the way intense cardio does, but it contributes significantly to overall energy expenditure and metabolic health. Manage stress and sleep. Elevated cortisol from stress promotes fat storage, especially visceral fat. Poor sleep increases cortisol and disrupts hunger hormones. You need 7 to 9 hours of quality sleep. You need to reduce stress. If James does this protocol correctly, in 4 to 6 months, his body composition will shift dramatically. His aromatase activity will decrease. His testosterone to estrogen ratio will improve naturally. The second piece is what you eat. Certain foods are actively working against your hormonal balance. Other foods are working for it. Let's talk about what to eliminate or reduce. Ultra-processed foods, especially seed oils like soybean oil, canola oil, and sunflower oil. These are high in omega-6 polyunsaturated fats, which promote inflammation. Chronic inflammation increases aromatase activity. Limit these aggressively. Alcohol, especially beer. Beer contains phytoestrogens from hops. More importantly, alcohol impairs your liver's ability to metabolize and clear excess estrogen. If you're drinking regularly, you're making your problem worse. Cut it back to 0 to 2 drinks per week maximum. Soy products, particularly if you're consuming them in high amounts. Soy contains isoflavones, which are phytoestrogens. Some men are fine with occasional soy consumption, but if you're eating soy protein powder, soy milk, or soy-based meat substitutes regularly, you're actively adding estrogen mimics to your system. Cut them out. Dairy from grain-fed cows. Conventional dairy is high in estrogen because the cows are often pregnant when milked. Switch to organic, grass-fed dairy or reduce overall dairy intake. Now, what should you be eating more of? Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, cabbage. These contain compounds called indoles and diindolylmethane, that actively support estrogen metabolism in the liver. Eat these daily. Fatty fish, salmon, mackerel, sardines. High in omega-3 fatty acids, which are anti-inflammatory and support hormonal balance. Organic vegetables and grass-fed meat. This reduces your exposure to pesticides and hormone residues from conventional farming. Fiber, especially soluble fiber from oats, flax seeds, and vegetables. Fiber supports gut health, and a healthy gut microbiome is crucial for estrogen metabolism. Dysbiosis, imbalanced gut bacteria, actually leads to increased circulating estrogen. This is where the estrobolome comes in. Your gut bacteria influence how much estrogen is reabsorbed into your bloodstream. With a healthy microbiome, excess estrogen gets excreted. With dysbiosis, it gets reabsorbed. If James cleans up his diet, removes the inflammatory seed oils, cuts the beer, eliminates soy, and starts eating cruciferous vegetables daily, his liver and gut will be able to metabolize and clear estrogen more efficiently. Combined with the body recomposition work, this is where the real shift happens. The third piece is supplementation. And this is where it gets interesting because most of these are natural compounds that support your body's own estrogen-clearing mechanisms. DIM, diindolyl methane. This is a compound extracted from cruciferous vegetables. It supports phase 1 and phase 2 liver detoxification. Basically, it helps your liver break down and clear estrogen. Dose: 100-200 mg daily. Calcium D-glucarate. This supports phase 2 detoxification and helps prevent estrogen reabsorption in the gut. Dose: 500-1000 mg daily. Milk. Thistle. Supports overall liver health and detoxification. Your liver is where most estrogen metabolism happens, so supporting liver function is crucial. Dose: 200-300 mg daily. NAC. N-acetylcysteine. Increases glutathione production, which is essential for phase 2 detoxification. It also supports the production of protective compounds in the body. Dose: 600-1200 mg daily. Omega-3 fatty acids. If you're not eating enough fatty fish, supplement with fish oil or algae-based omega-3s. The anti-inflammatory effect is important. Dose: 2-3 grams of EPA daily. Vitamin D. Many men are deficient in vitamin D, and deficiency is linked to hormonal dysregulation. Get blood tested and supplement to maintain levels of 50-80 ng/ml. Dose varies based on baseline levels. Probiotics, specifically a multi-strain probiotic that includes lactobacillus and bifidobacterium species. These support a healthy estrobolome. Look for CFU counts of at least 10 billion. Now here's the important thing. These supplements are not magic. They're supporting what your body is already trying to do. They work best when combined with the diet and lifestyle changes we just talked about. If James takes DIM while still eating seed oils, drinking beer, and maintaining elevated body fat, the supplement isn't going to save him. But combined with the other two protocols, they accelerate the process significantly. Here's the real question. How long does this take? If James commits to all three protocols, body recomposition, dietary intervention, and supplementation, here's what he can expect. Weeks 1-2, probably no noticeable change. His body is adjusting to the dietary shifts. He might feel slightly better due to the reduced inflammation from cutting seed oils. Weeks 3-4, his energy starts to improve. Sleep might get better. Gym performance might stabilize or slightly improve. Weeks 6-8, noticeable improvements in mood and clarity. His libido starts to return slowly. Energy is noticeably better. Body composition is shifting. Weeks 12-16, this is where the magic happens. His libido is returning to normal levels. His mood is significantly better. He's building muscle again. He feels like himself. Energy is consistent throughout the day. Weeks 16-24, he's fully back. His body has recomposed. He's lost fat and built muscle. His hormone levels are normalized. He feels strong, motivated, and sexually confident again. But, and this is critical, this assumes he's consistent. It assumes he's actually doing the work, not just thinking about doing the work. The men who get results are the men who track their calories, not obsessively, but enough to maintain the deficit. Actually eat the cruciferous vegetables, not once a week, but daily. Stay consistent with training. Stop drinking beer or reduce it to near zero. Sleep 7 to 9 hours. Actually take the supplements. If you're 50% committed, you'll get 20% results. If you're 80% committed, you'll get 80% results. Fast forward 6 months. James is in his office and his business partner makes a comment. "Dude, you look jacked. What have you been doing?" James laughs. He's not on gear. He's not on testosterone replacement. He's just finally fixed his hormone balance. His lab work? His estradiol is now at 28 pg/ml, back in the healthy range. His testosterone is at 680 ngdl, basically the same, but now his ratio is normal. His libido came back around month 3. His wife noticed first. He's initiated sex without hesitation for the first time in 3 years. His body composition changed dramatically. He's at 13% body fat, and he looks completely different. His chest is defined, his face is sharper, he looks younger, his energy is consistent. No more 3 p.m. crash. He's actually enjoying his workouts again instead of grinding through them. His mood is elevated. He's more patient with his kids. He's more confident at work. He feels like himself again. And here's the key thing. He did this without pharmaceutical intervention. He did this by understanding the mechanism and addressing the root cause. This is what's possible when you stop chasing the obvious solution and start investigating the real problem. But let's be clear about what happens if you ignore this. If you have elevated estrogen and you do nothing about it, the problem compounds. You continue to accumulate body fat, especially visceral fat. Visceral fat increases aromatase activity, which increases estrogen conversion, which increases fat storage. The cycle accelerates, your sexual function continues to decline, erectile dysfunction becomes more pronounced, your relationship suffers, your muscle mass slowly decreases as you age, which further decreases your metabolic rate, which makes it easier to gain fat. Your mood and motivation get worse. You might develop depression or anxiety. You might turn to unhealthy coping mechanisms, excessive drinking, other substances, disconnection. You feel older than you actually are. Men in their 40s tell me they feel like they're in their 60s. That's often estrogen dominance. And if you eventually go to a doctor and get prescribed something like TRT, testosterone replacement therapy, you haven't actually fixed the problem. You've just added more testosterone to a system that's still actively converting it to estrogen. So you might feel a temporary boost, but the underlying mechanism is still broken. You're paying money every month and still not actually healthy. This is why understanding the mechanism matters. This is why fixing the root cause matters. So here's my challenge to you. If any of this resonates, if your testosterone came back normal, but you still feel terrible, if your libido is gone, if your energy is in the gutter, if your body composition is shifting in ways you don't like, do this. Get your estradiol tested, not just testosterone, estradiol. Find a doctor who will order it or use a private lab. Find out where you actually stand. Then, commit to the 3 protocols for 12 weeks. Not partially, fully. Fix your body composition, clean up your diet, take the supplements, see what happens. I guarantee you'll be shocked at the difference. This isn't about becoming obsessed with optimizing. This is about feeling like yourself again. About having energy, having a functioning libido, about looking in the mirror and recognizing the man you know you are. You deserve that. And it's possible. The question is, are you willing to do the work? Your testosterone might be fine, but your hormones probably aren't balanced. And that's a completely different problem with a completely solvable solution. Now you know. What you do with that knowledge is up to you.